Hello, everyone. My name is Jessica Yurden. Before we get started, if you do have any questions during our presentation today, be sure to type them into the chat box on your control panel. I'd like to welcome everyone to our complimentary webinar series. Today, we once again have Linda Despain with us to discuss some time management tips to help your practice be more time efficient and increase patient satisfaction. She is a medical practice management consultant and certified medical compliance officer with more than 30 years of experience in all aspects of healthcare management, compliance, coding, and reimbursement for multiple specialties in a group practice setting. She has also served as an independent review organization for the Office of the Inspector General and consulted for the Texas Medical and Dental Boards. Today, Linda is going to speak with us about how some time management practices are vital to the success of your practice and how completing work in a manner that is time efficient and stress-free will not only improve office operations and employee morale, but improve the overall patient experience as well. Thank you for joining us today, Linda.
Well, thank you so much, Jessica. It's great to be on the call. And again, I like to call us the dynamic duo because there's so much vital information that we can share. And today is a very important and exciting topic when it comes to time management because, yes, this is a very important topic. When it comes to running a practice smoothly, it is vital to improving patient care as well as compliance. And so when I think about time management, I think about, especially in a medical practice, it's sometimes very difficult to manage time, but to effectively manage time, we have to understand that time itself can never be managed. One has to manage oneself. And so, what I mean by that is, I don't know if you know this, Jessica, but the average person gets interrupted one time every 8 minutes. And so, again, we're not managing time, but we're managing ourselves and we're managing the interruptions. And so an interruption one time every 8 minutes, that is approximately 7 times an hour a person gets interrupted. And it can be up to 50 times per day. And so on average, each interruption can take about 5 minutes of someone's time, which could then relate to 4 hours in a workday. So with these statistics, you start to think about this is why time management can really be very difficult because we can manage ourselves, but we can't manage time. So again, 80% of those interruptions have very little or no value at all. And it can create approximately 3 hours of wasted time each workday. And so this can be vital in a medical practice because that is time that is taken away from patient care, from examples of returning patient calls, calling in prescriptions, getting lab results, reviewing medical records, also, being compliant in all areas of compliance. So, again, an entire day is wasted by those interruptions.
We definitely do get interrupted a lot every day in our jobs, and that's a lot of good information on why effective time management is so important for the medical practice. Can you provide some examples on how a lack of time management or even poor time management skills can affect a practice?
Yes, exactly. So talking about some examples on how a lack of time management or poor management skills affect the practice is usually the practice is not going to be run efficiently. And so what that means is that in an 8-hour day, 2 to 3 hours are wasted on time that is absolutely non-productive. And in those cases, in my experience, what I see is generally a provider has so many interruptions that they personally cannot finish their medical records in a timely fashion. A biller or coder cannot complete all of their billing by the end of the day. The claims are also not dropped within a 24 to 48 hour time frame, meeting and exceeding national benchmarks. And medical assistants are not being able to return patient phone calls, call in prescriptions, or make sure that labs or any type of ancillary services have been followed up. So it is super vital. It also means that there could possibly be a lot of overtime in the practice. And that's usually the case because somewhere along the way, those 2 to 3 hours of interruptions and lack of time management are wasted. And therefore, it's very costly to a practice in overtime, again, and lack of proper billing, timely collections. So poor management skills can affect a practice in many, many ways.
Oh, definitely. And that shows why good time management is so important. From an office manager's perspective, what steps should be followed when implementing time management practices?
That is an excellent question, Jessica. So when it comes to a manager's perspective on following good time management, there are a couple of things that need to take place here. I will tell you from personal experience, it is very easy for people to get into a situation where they feel that they have to do it all. They feel that it's easier for them to do everything than to delegate because for some reason they have not been able to train someone to take on additional tasks, or the person that is delegated those tasks don't do it correctly. And so sometimes it is very important, 2 things to remember about time management. Again, we can't manage time, we can only manage ourselves. So a couple of things that are important to know is, number one, we cannot do it all. And number 2, you must organize and execute around priorities. And so some of us, especially like I said, in healthcare, me personally, I will admit that every now and then we get into what is called an urgency addiction. And what that means is that we get into basically a crisis management mode. And so it becomes really a fundamental operational pattern where we get into the point of 8 interruptions, or an interruption every 8 minutes. We're interrupted, 7 times an hour. The important, urgent tasks are not getting done because we are spending time in trivia, busy work, time wasters. So when it is time to perform what is important and urgent, priority number 1, we get that adrenaline rush and that urgency addiction, and then we are working to meet very important and urgent timelines. So the very first thing that we need to do to effectively manage time in a practice is to, first of all, identify what is important and what is urgent. And so we need to, again, manage oneself because we all have the same amount of time in a day. And so we have to concentrate and focus on, number 1, what is important, what is urgent, what needs to be done now. And generally, in medical practice, the number 1 thing that we're going to focus on at all times is patient care. And so we're going to take care of patient care, patient needs, filling orders from our providers, quality of care issues, deadline-driven projects such as billing, coding, collections, and that's where we need to focus. Then the next area that we're going to focus on is step 2, where we plan. So step 1 is what we do. We do the important and the urgent, and we handle all of our patient needs at all times, keeping our patient on the radar. Number 2 is where we plan. Number 2 is where we spend time planning non-urgent issues. They're non-urgent, but they are still important. And if we don't plan properly, then they're going to become urgent, and we might get into another crisis management mode. So step 2 is the plan, and this is where we work on building relations with our patients, spending a little extra time with the patient, understanding their needs, making sure that all of their needs are filled, also seeking maybe new opportunities for the practice or for the manager or for the team. It's really strategic thinking. Again, we've got to spend that time to think strategically, maybe working on succession planning, maybe thinking about growing the practice, maybe expanding, maybe not, maybe we're downsizing, but anything that we can do also to improve any systems and planning on all of the compliance training, everything that needs to happen in the practice to run a very efficient practice. And in step 3, as I mentioned earlier, it is important to learn how to delegate and to delegate well, because that is the only way that we're going to be able to manage those interruptions and gain back the 3 to 4 hours a day of interruptions. So when we learn to delegate and delegate properly, we can continue to focus on what is urgent, important, and to plan.
Oh, for sure. And bringing up delegation, can you go a little deeper into it and how it can affect the manager and employees specifically if it's not carried out in an effective way?
Absolutely, Jessica. So delegation, as I mentioned earlier, it can be very difficult to delegate. As managers, we have proven our skills and our time management, and we do things right. Managers do things right, and so sometimes we have had some poor experiences with delegating, and they didn't go well, and the manager is frustrated and says, if I had just done it myself the first time, it would have been done right. Now I've wasted all this time trying to train someone and teach them to do it, and they made a mess of it. So when it comes to delegation, managers have to remember that they cannot control everything. And by thinking that they can do it all, it's a misplaced sense of responsibility. And so when it comes to time management, delegation is actually the most effective time management tool. And so when it comes to delegation, it is important to learn how to give instructions for the job to be completed. First of all, an office manager needs to learn that they're going to have to trust their team. They're going to have to trust that they can delegate. They're going to have to learn about their team member, learn how that team member best communicates, especially as we have such a diverse culture of workforce these days. Some people learn best by face-to-face verbal communication. Some people learn best by having written instructions. Some people learn best by hands-on doing. So the very first tool in delegating is give specific instructions for the job to be done. Sometimes it's better if the manager writes out the instructions and hands the person the notes so that the person has the instructions in writing and then can make notes on that page. And then have the employee repeat the instructions and what needs to be done, when it needs to be done, how it needs to be done, when it's due. And then try to monitor progress without micromanaging, without checking up on them, but have that employee report maybe at the end of the day, maybe a couple of hours into the project, show the manager what's been done, how it's been done, so that if there are any problems, issues, questions, they can be addressed early into the delegation process. And then set definite timelines for accomplishment of the goals or any completion of the task. It's also important for a manager to give encouragement consistently and also be able to provide constructive feedback so that the manager can communicate to an employee maybe what the employee is not doing so well. But the good thing is once an employee is trained on certain tasks, that could be another project or a interruption now that manager doesn't have to deal with. They can say, go see Mary. Mary's in charge of that project, and Mary's handling that project. And so Mary has the confidence, the ability, the instructions, and the skills to run with that. And the other thing that I always talk about when it comes to delegating is to remember that every manager is probably a manager today because they had someone that believed in them, that delegated to them. And so therefore, as managers, we have to be leaders, and we also have to believe in our staff, plant seeds, water, grow, give them that opportunity. So it's a win-win, not only for the employee, but for the manager as well.
That's a really good point. And, having good delegation skills definitely impacts the time management process. And you had also mentioned a little earlier on about prioritization. And speaking of all the delegations of tasks, maybe there may be situations where employees feel like they have a lot of tasks and they may not know exactly how they should prioritize them. Could you go a little bit into the importance of prioritization when it comes to time management?
Yes, absolutely. So when it comes to prioritization and time management, it is very important that everyone, look at their schedule, make sure that everyone is working on what is important and what is urgent. And so once the manager has proven that they can manage their time and they can delegate, then it's very important to teach the employees how to manage their time. And so to help the employees manage their time, there are some time management tips. So for example, I encourage everyone to know their peak performance. There are algorithms that we all have. And so sometimes people have peak energy levels first thing in the morning people. Some people are night owls. But everyone has a time of day that they feel the most energy. So when it comes to, first of all, knowing the energy level and peak performance, it is best to handle any tasks that are someone's least favorites, most challenging, maybe stressful when energy levels are high. So sometimes that's first thing in the morning. So work on any priorities that are most stressful, most challenging, or least favorite when energy levels are high. And so it is important to know that. That helps with some time management. When someone is tired, fatigued, not at peak energy level, sometimes it can take twice, sometimes 3 times as long to accomplish that task because it's just drug out. So we want to handle that task in the least amount of time and also be able to provide quality results. That's the other situation that I want to talk about. Sometimes when it comes to employee time management, employees are quick to get the job done. They think they're managing their time because their desk is cleared off and the job is done. And so they think that they have done everything within the time that they're supposed to. But guess what? The quality is not there because they did the job quickly in order to manage time. So what we need to do when it comes to managers helping employees manage not only time but quality of work as well is that we need to, it is helpful to have a little stand-up meeting every morning. This would only take about 10 minutes, but at that time, address all issues. This, again, is going to help with those interruptions that I talked about earlier because we can address everything right then and there, 10 to 15 minutes, stand-up meeting. What are the priorities today? You know what else is a good tool to help employees with time management is a very good job description. A very good job description that the employee has in front of them at all times trains the employee on what tasks need to be performed, but also when and how, especially in delegating to a task to an employee, giving them, again, those timelines. So employees may be very productive throughout the day, but again, they're not performing quality work and they don't know their priorities. So therefore, sometimes an employee is rated as not a very good employee in time management because they're not managing their priorities. So in those stand-up meetings every morning, talk about, what day of the month reports are due, or for coders, billers to get claims out the door, to work on examples such as rejection reports, denials, collections. So, really, again, we don't want to micromanage, but just talk about the top 5 priorities of the practice that need to be accomplished that day, that week, that quarter, whatever the case is, that time frame. Review the patient schedule for any special circumstances. So thinking about your front desk staff, your medical assistants, reviewing the patient schedule, helping your doctors with their time management, making sure that everyone is looking at the schedule, what patients are coming in. There's nothing more embarrassing for a doctor who is walking into a patient exam room and the patient is there for follow-up on say, for example, an imaging order such as an MRI. It's not in that patient record. That's a huge time waster. The doctor has to go back to the medical assistant, have to call the imaging company, get the MRI. This could be a huge risk. Something is done in a hurry. Maybe something is missed by the provider because he was in a hurry, he or she was in a hurry to get that report and talk about it with the patient in a waiting room. So we want to review the schedule, make sure patients that are coming in for follow-up, there's documentation on follow-up for what, an image, lab, surgery, whatever the case is. So everyone looks sharp. Everyone is managing time. Give, again, special instructions to the staff on all the jobs that need to be completed and when. And then I also encourage managers to give your employees, that to-do list to help them to develop their daily, weekly, monthly, quarterly, annual goals. So you as a manager, sometimes have to give that employee that map to help them with their time management.
Definitely. And another thing that managers have to consider is employee time off. How is that best handled?
Yes, so that is another challenge that we run into. Of course, employees are entitled to time off, and nowadays with our practice profit margins being razor thin, we really need all hands on deck and everyone on the job. But good time management means that everyone in the practice is cross-trained so that everyone can cross-cover and everyone can take time off that they deserve without it impacting the efficiencies of the practice. So when it comes to good time management, working as a team and having everyone cross-trained. So basically, everyone can be cross-trained to manage the front desk, to answer the phone, to schedule appointments, to check out. And so that keeps the front desk flowing, especially during peak times, high patient volume cycles. Every practice has a cycle where there is a higher volume of patients. And so we want everyone trained at that front desk to answer those phones and be able to communicate effectively, schedule effectively. Now, when it comes to medical assistants, now that does sometimes require, obviously, special training, but still anyone in the office can certainly be trained on how to take and record vital signs, how to clean a room, how to stock a room, to keep the clinic area clean and flowing, get a patient in a room, get those vitals so that the clinic can run smoothly. Also, when it comes to billing and coding, it does help to have a couple of billers, coders, cross-trained, so that you can keep every process in the practice running efficiently, because my saying is efficiencies translate to profits. And so when we are effectively, efficiently managing ourselves, managing interruptions, and delegating, the entire practice can flow very effectively and very efficiently.
Thank you, Linda. And you're a certified medical office manager through PMI. Could you go into how an office manager should approach training staff and being more time efficient?
Yes, absolutely. So first of all, I really strongly do believe that every office manager does need to get education, and I'm a strong advocate for certification. So not everyone can get a degree in business administration, but if even though a person does have a degree in business administration, running a medical practice is an entirely different industry and a different field. And so there is so much that needs to be, that a medical office manager needs to be aware of. And so I do, number one, recommend that the certification, is a must. And of course, I am an advocate for Practice Management Institute being, a leader in healthcare education. And so training the medical office manager to begin with, good time management techniques and skills are part of the Certified Medical Office Manager curriculum. And then as a Certified Medical Office Manager, one is taught how to manage and how to lead. And so when it comes to training the entire office on time management, it's not always just managing, Jessica, but leading. And so a good leader is able to inspire and train at the same time on how to manage time and effectively.
Definitely. We do have a couple of minutes left, Linda, so would you mind just providing a few more tips on how people can manage or how the office manager can manage employee time?
Yes, absolutely. So when it comes to managing time, again, what we're going to do is look at all of the priorities, especially around patient care, around revenue. Also, what I do like to talk about is managing provider time, because if our providers' time is not managed properly, it can trickle downhill to the entire staff and to patient care. It actually can affect patient care. One of the biggest issues that we have in practices when it comes to time management is patients wait a very long time to be seen in the practice. So number one, either they can't get an appointment when they need to, so there's a delay in getting an appointment in the practice, and when they're in the practice, sometimes there's long waits. Patients think that they should not have to wait more than 15 minutes to see the doctor. So when it comes to training staff on good time management, what is also important is helping the provider with time management. So it all works together. So when it comes to provider time management, we need to have very good communication. So training the staff, the medical assistants, the front desk staff to communicate effectively with the provider and vice versa, so that we know if the provider is going to run late getting into the office or is running behind because patients are taking more time than their appointed time. Whatever reason the delay is, it is very important that there's good communication and helping that provider to manage their time, staying on task with the patient's schedule, and or if they have emergencies. So again, training everyone in the office to help the provider manage their time, training the medical assistants, the front desk staff, work with the doctors. Again, those are some other things that we would talk about in that stand-up meeting.
Thank you so much, Linda, for sharing all this great information with us today.
Oh, absolutely. It's my pleasure. I definitely could, talk more about this in more detail, probably for hours, but, I'm really glad that everyone could carve out at least 30 minutes to get some of the highlights and some tips. Again, a lot of people know this, but sometimes it's a really good refresher to, take back to the table and take at least one or two tips that could be used to help people manage time and manage time, manage oneself, manage those interruptions, and improve opportunities to improve compliance, areas of compliance, patient care, revenue, again. And everyone also has better job satisfaction when they know that their time is well used. A lot of people don't want to work overtime, but then again, the practice shouldn't be paying overtime just because of poor time management. So it is a very valuable opportunity to improve in these areas.
Oh, definitely. Time management skills are obviously very important. I did want to bring everyone's attention to this slide. If you do have any questions, please send an email to info@pmimd.com. If they're specific to Linda, we'll be sure to get them over to her. If you do have any general questions for PMI, you can use that email address, or we do have a chat on our website that's operational Monday through Friday, 9 a.m. to 4 p.m. Central Time. I'd like to thank everyone for joining us today, and I did want to mention that all attendees are invited to download our free ebook called The Medical Office Manager's Guide to Time Management, and details on how to download this will be sent in an email following the webinar. Thanks everyone once again for joining us, and I hope you all have a great afternoon.